Hi guys, today we will learn the cupping. So the first question is, what is the meaning of cupping? It's a kind of extended treatment method of traditional Chinese medicine. We're using various methods to eliminate the air in the cup or jar to form negative pressure so that the cup absorbs the body surface to treat and prevent diseases. Here, various methods means we can use fire, like burning materials, alcohol, cotton balls, or papers. The second is suction. The third, we can use press. If the cup is made of rubber, we can use press, and so other things. Second question, what kind of cupping are there? According to the made of materials, we can divide the glass. Here, I bring small cups. This is very small glass. The small glass is an advantage. Can see the skin more clearly. But the disadvantage is what? It's easy to be broken. If you fall to the ground, it will be broken to pieces. Second, we call the baboon. You see, this is a baboon. So this one also has disadvantages. Easy to be cracked means what? If too dry, there are some cracks around the circle. If the bamboo cups crack, it's no use, useless. Okay. Sometimes we can use made of rubber. The advantage is what? It is to be operate, but not too much power. The fourth we call ceramical. Ceramical is expensive. We can't see the skin of color, so this also not so good for in the clinic. And horn, usually with the ancient times, about 2,500 years ago, we have a book recorded the ancient people. They use the animal horns to cupping. Third question is, what is the function of cupping? First, it promotes smooth meridians. The second is vigorous qi and blood. Means what? Means can produce plenty of qi and blood. Third, activating blood circulation. Means can flow the qi and blood. Fourth, relieving pain. Here, normally we mention the chronic pain, not the acute pain. The chronic pain is more suitable. The fifth, we call it dispersing the cold. Demidifying means reducing dampness. The sixth, we call antipyretical, means reduce fever. If you have high fever, more heat, we can use cups. 7, my teacher told me, cups can let the evil factors off. From TCM theory, the old diseases is caused about the evil factors. The 8, we call the prolonged therapeutical effect, because sometimes you after needle or after trainer, maybe the second day, the day after tomorrow, there's no other feelings. But if you use the cupping, maybe can prolong 3 to 5 days, then the cupping marks will disappear. The fourth question is, how to operate cupping? Here a list of 3 ways. First is a fire incision cupping method. Second is fresh fire cupping. The third is moving cupping. I will show you how to operate the fresh fire cupping later. Here are some pictures. You can see the fire cuppings and also the water cupping, sometimes with medicine. So we call the medicinal cupping. The left one is the suction cup. It's made of plastic. Here is the bamboo medicine cupping. So lots of cups deep into the medicine. The moving cupping, from the top to the bottom. And we also use some ointment for protecting the skin. Here some exercises using the cups for their pain. So when I see the third pictures, I remember one thing. In 2009 in summer, one day my patient, she is a Chinese ambassador in one African country, told me when she went to the swim, she went into small pool, then the other people all went out the small pool, then jumped into the big pool. Only she was in the small pool. Then she also went out and jumped to the big one. But when she jumped into the big one, the other people went out the big one, then went into the small one. So some woman just stopped swimming. She was worried. What's wrong? Why would like this? She asked them. Then they all point her back, because that day, just only one day after cupping, so the cupping markings are still very dark. They said she was severe disease just after radiation. So it's very important to spread TCM. Now we see the whole procedure of the cuppings. First, we will say the check. Check for two things. One is for the facilities, means the cups. The other is the patient's place. The second is evaluations. Third, we call the preparing items, means what kind of things we should prepare. The fourth, we should implement, means you should do. Then during the implement, you should observation. Observation, what? You should observation the color of the skin, and also you should ask the patient whether he has pain or not. After the cupping, you should knitting. Yes, you will prepare the whole facilities for next time use. Then you should sign and record the whole histories. So during the whole procedures, we should pay more attention to two things. First, we should pay more attention on fire, because fire is dangerous. Sometimes it's bigger challenge to the patients. Second is we should pay more attention on patients' pain and panic, because normally patient has pain, but during the cupping still have pain, so the patient normally will be worried about. Okay, I wish you will understand this. Later I show you how to operate on the patients. So this is a glass cups. So before you use cupping, you should check the cup, whether it's broken or not, especially in the circle. If the circle is broken, because it's harm to the patient's skin. So first we should check whether it's smoothly. If it's smoothly, it's better, and no crack. And also, if you use the bamboo is easy to be crack. So you should check if they have cracks, because you can't absorb tightly, because the air can come into, so can't produce the negative pressure. So we should check whether it's a crack or not. This is a new one, so no crack, so we can use. So this is we said check the facilities. Another check, we should check the patient's area. Second, we should check the patient's area and the position. Normally we use the lie on the front, because if you lie on the front, the back a little bit more flat, so it's easy to be cupping. So then we can check the skin. If the patient's skin is broken or bleeding, you can't use the cups. Now it's okay, we can use the cups. You see. Today I will show you how to operate the cupping. Here I list two types. One is glass, Another is the bamboo. So sometimes we also can use the rubber, and a different size, different size. So when you use cupping, first you should pay more attention to the echo, because if you use the echo cotton, too much echo, it's not good. So first we should use echo. You put not too much echo. Then in the low back, normally use in low back. That was lighter. Okay. So remember. It's cold. OK， so 地方稍微小了一点，稍微下面一点。OK， yes, I can use bamboo. Tight. It's tight. Yes. Then, so normally we should last for 5 to 10 minutes. But according to the different patients, different plants, the time you can change. Because sometimes the color is very dark, then we can reduce time. Maybe 3 minutes or 5 minutes is enough. But some people, if the color is not too dark, it's shadow, so it can last for 10, even in 15 minutes. So depending on the area, depending on the diseases. Okay. But normally when you use cupping, you don't use a heater on the top of the grass or on the bamboo. You can't use the heat, otherwise it will damage the skins. Maybe I can cover it with the clothes. Yeah. And I also just ask a patient, just be relaxed, don't worry. It's no damage. And sometimes we should check the color of skin. If too dark, you should remove the cups. Yeah. So cups normally use the big area, like low back or upper back, and even on my leg. The big areas it's can suitable. Yeah. Suitable for the big areas. Yeah. During the cupping, if a patient say too much pain, you can more release, can remove the cups. How to remove the cups? First, you use the same, just a push on the side, then let the chi inside, then can remove it. Here also, yes. Okay. So after remove the cups, we should relax the local area, because needing manipulation, or tap, because the fire is sucking the skin more tight. So normally a little bit of pain around the circle of the cups. So we should relieve the pain. Okay, like this.